Okay, hello everyone. Welcome to webinar series Challenges of Expanding Access to Health Products in Fight Against Neglected Tropical Diseases. This webinar is organized by Japan Alliance on Global Neglected Tropical Diseases, JAGntd, and sponsored by Global Health Innovative Technology Fund, JHIT Fund. My name is Kota Yoshioka, Assistant Professor at the Institute of Tropical Medicine, Nagasaki University. And it's my great pleasure to have you all in today's webinar session. Thank you for coming. This webinar series is designed to discuss key access challenges in the field of NTDs. In the previous session in November, that was a little bit busy one, but we could examine the access issues around pediatric praziquantel, which is a candidate drug for treatment of schistosomiasis in children. And now I will invite my team members and let's see what they learned from the previous session. First, I'd like to invite my co-moderator, Isaac. So Isaac, please introduce yourself and share one point that you learned from the previous session.
Thank you very much, Yoshioka-san. So I'm Isaac. I'm the Director of Access at the Global Health Innovative Technology Fund, and we're co-hosting this webinar series with JAGntd. So the lesson that I learned from the last session was that it was very interesting to see that even though the development of the medicine is still in the process, both the product developer and the country, Tanzania, are already preparing for access and delivery quite early on. The product is likely to be on the market 2 years from now, but I think it's very important to start the preparations, because if that doesn't happen, and you wait until the product is available, then it will be 2 years before the product can actually reach the patient. So I think it was a very interesting lesson to see the preparations from both the product development side and the country side. Thank you.
Great. And yeah, that's the right point of the previous session. Prepare as early as possible. So I will invite now Taro-san. Go ahead, Taro-san.
Hello. I'm Master's of Public Health student working for JAGntd right now. And last session, I learned that although pediatric praziquantel has an advantage of having a preceding model of praziquantel for adults to start with, there are still many barriers in distribution regarding the lack of funding and lack of epidemiological studies towards the young population. And there was also a mention of integrating the already existing mass drug administration system in distributing the PPZQ when they are approved. So in this session, I'm looking forward to hearing how the ESPEN has been and will be supporting the various MDA programs throughout Africa.
Okay, that's a nice point, and connecting the previous session with the session today. And so this is my point. I think there is still concern about user and affordability of pediatric praziquantel, which means whether a patient can get pediatric praziquantel at an acceptable cost. And if pediatric praziquantel will not be donated by manufacturers, someone else should pay for it. And the question is who? And if this drug will be financed by national health insurance schemes of the Tanzanian government, that may be a good news for access, but affordability issues still remains as a concern for uninsured populations. So how to ensure equity of access or equitable access may become an important issue in the future. Great. So let's move on to today's topic, ESPEN. ESPEN is the WHO's regional project to eliminate 5 NTDs in Africa. And ESPEN has successfully mobilized political, technical, and financial resources to accelerate mass drug administration of donated medicines. And the government of Japan has made also financial contributions to ESPEN since 2019. And in today's session, we want to learn how ESPEN helps African countries to distribute NTD medicines and why such an external assistance is necessary. So let me invite today's speaker, Mr. Modeste Tezembong. As a WHO's technical officer, Modeste manages ESPEN's drug supply chain. He will talk about key access challenges that he faces in African countries. So Modeste, over to you.
Okay, thank you very much, Taro. I'm very happy to be part of this session, and I'm very interested in sharing ESPEN perspective and etc. what we have been doing so far. So as you know, ESPEN is part of WHO, and it is based at WHO Regional Office for Africa. And ESPEN has a core objective, objective number 3, on ensuring effective use of the donated medicine. And this is linked to the WHO Global Program of Work, Output 131, which is on ensuring equitable access for quality assured medicine, vaccines, and health technologies for primary health care. And this includes ensuring accessibility, affordability, availability, and acceptability of quality assured health commodities. So, as you know, ESPEN is doing great since 2016. You know, ESPEN started in 2016 after the AFRO program was closed and now managed by ESPEN project. Okay, Diapo. Next. Okay, so just a brief presentation about myself. I'm Modeste Tezembong. I'm a health procurement and supply chain management advisor with extensive experience in health commodities such as HIV/AIDS, TB, malaria, and NTD drugs, neglected tropical disease drugs. So I'm currently serving at the regional level as the regional technical officer for the ESPEN project for the donated medicine supply chain management. And before joining ESPEN, I work with several organizations like Elizabeth Glaser Pediatric Health Foundation, which is a US-based international NGO. I also work with UNICEF, IOM, MINUSCA, etc. And those organizations on projects funded by UNITED, WHO, USAID, CDC, PEPFAR, BMGF, and the CIF, and Johnson & Johnson, ECHO, etc. So I have a master's degree in logistics and supply chain management from Institut Université de la Côte. I also have a postgraduate diploma in global health procurement and supply chain management from Empower School of Health, which is based in India in collaboration with Kent State University, etc. Yeah, and I have certificates in procurement of medicine and essential product from I+ Solution or I+ Academy, which is a procurement agency, I think for the Global Fund or and other health procurement institutions. So Diapo, next. Okay, so today we are going to present the ESPEN and the status of PC NTD control in the African region. We'll also discuss about major access to NTD medicine challenges in the African region, and we will present ESPEN achievements to expand access to PC NTD in the African region. And lastly, the ESPEN perspective for the future years. Next. So, okay, what is ESPEN and how it works? As you know, ESPEN is a partnership, including countries which are low and middle income countries in majorities. I want to say that the donated medicine are not only for the African region. You also have the South America, and I think India as well. So in different WHO regions. So ESPEN is made of countries WHO country office, WHO regional office, headquarter, and we also have donors, including implementing partners. We have a core NTD. As you know, core NTD is also part of the ESPEN partnership. And we have pharmaceutical industry, pharmaceutical donors as well, that are part of the ESPEN. We have freight forwarders, the logistic companies that are part of the partnership. ESPEN is made of several actors that contribute to delivering high number of drugs to the African region. And you know, most NTDs, neglected tropical disease, are present in Africa. So what I wanted to add was the NGO networks, the NNN. You have several NGOs as implementing partners on the ground. Those are also part of the ESPEN partnership. So in concrete, ESPEN is a group of like-minded partners from both public and private sectors fighting to eliminate most prevalent neglected tropical disease in Africa. ESPEN provides technical and operational support to endemic countries in their effort to control and eliminate neglected tropical disease through large-scale distribution of high-quality, safety-tested neglected tropical disease medicine, what we call mass drug administration. So we also have pharma sector donates life-saving drugs to WHO to ensure that these drugs reach all those who need them most, and that it helps to achieve the intended purpose. It is crucial to support delivery programs such as ESPEN. In terms of strategic priorities, you have the priority number 1, that is scaling up mass drug administrative campaigns to achieve 100% geographic coverage and effective therapeutic coverage. Objective number 2, strategic objective priority, is scaling down mass drug administration toward preventive chemotherapy elimination and reduction of those at risk for neglected tropical disease. We have the objective number 3, that is strengthening information systems for evidence-based implementation level decision-making. And then the objective number 4, that is on promoting effective use of donated medicine. These include, like I said, increasing access, equitable access, and availability, affordability, acceptability. So those are criteria that really help to ensure continuity of the supply and that endemic populations can have access to those medicines. Yeah, then we have the objective number 5, that is advancing progress on sustainability through efforts to enhance country ownership and strengthening health systems. So those are the 5 ESPEN priorities. Next. So regarding the preventive chemotherapy, neglected tropical disease control in the African region, you know, ESPEN focuses on 5 major diseases. These include schistosomiasis, which is treated with praziquantel, onchocerciasis, which is treated with albendazole, and also sometimes mebendazole. We have lymphatic filariasis, which is also treated with albendazole and sometimes mebendazole. And then you have soil-transmitted helminthiasis, treated with mebendazole. And then we have trachoma, that is, we use azithromycin, Zitromax. I think those are the drugs that are used to treat trachoma. And I want to add that onco, we have diethicarbamazine, as you mentioned earlier. You know, Japan is the donor for the pharmaceutical donor for diethicarbamazine, which is used for onco and LF. So in terms of progress, you know, onchocerciasis, for example, we have 280 million people at risk, with more than 99% in Africa and 50% in Nigeria and DRC. So those are greatest countries in terms of onco-LF, those that are endemic. Then you have 31 countries endemic in the African region, 31 countries endemic, through which 27 are in Africa, 2 are in AFRO, and then 2 are in PAU. So we have a population of 2,100, I think it's 270 million people requiring mass drug administration in 2019. So you have this in the report, the WHO report of 2020. And then you have 4 countries verified by WHO, etc. Then regarding soil transmitted emintiasis, globally, there are 1.5 billion people infected, 267 million of preschool age children, over 568 million school-age children that need preventive chemotherapy. This is for soil-transmitted emintiasis. And over 600 million people infected by Sterocolitis. And 49% of burden is in Africa. And 44 countries need preventive chemotherapy in Africa. So, okay. So we look at the lymphatic filariasis, 72 countries globally, among which 859 million people in 50 countries live in areas requiring mass drug administration. This was in 2019. And then 57% being in CRO, while 39% is in AFRO, 32 countries, about 32 countries. So 48 million people no longer requiring preventive chemotherapy due to successful implementation of the WHO strategies, the ESPEN strategies. And then you have 17 countries validated as free of lymphatic filariasis by WHO as of 2020, 2 in Africa, mainly Togo and Malawi. So regarding trachoma, about 44 countries are endemic with a population of 136 million people living in at-risk area, 1.9 million visually impaired or irreversibly blind. So this is regarding trachoma. And 11 countries validated as having eliminated trachoma as a public health problem. Then in the African region, you have 116 million at risk, 116 million population in areas at risk, and 85% global burden, etc. So this is the case for schisto, with about 236 million people requiring preventive chemotherapy, and 105 million people reported in 2019, and about 78 countries, and PC required in 51 countries. In the African region, around 41 countries out of 51 countries for preventive chemotherapy are in Africa, and 92% of the burden is in Africa as well. And about 211 million people requiring PC. This was in 2019. So the figure may have been up or down based on the progress for each disease. Okay, next. So this is the overview of the neglected tropical disease medicine WHO managed donation in the African region. So we are not presenting here the medicine that are donated and managed by other organizations. I am mentioning, for example, the International Trachoma Initiative, which manage the Zitromax for trachoma, or the Mexican donation programs that manage ivermectin. So those are separate donations mechanism. Yeah, although it is still assisted by WHO in terms of medicine application, in terms of programmatic implementation, etc., and guidance, technical guidance, etc. So over the last 5 years, if I can say, from 2016 to 2021, over 3.3 billion tablets were donated to the African region. You can see through the graph the trend of the donation. For example, in 2016, with more than 500 million tablets, which became low, the donation became low in 2017, and then went up again in 2018 with more than 600 million tablets. And then this has been decreasing in 2019 and 2020, you know, with the COVID-19 pandemic, etc., and all measures that ESPEN has been putting in place to improve the management of the donated medicine, including accurate inventory management and awareness across accountability and responsibility in the management of the donated drugs. So, okay, we have also seen an increase in 2021, where it's near to 600 million, but not yet to 600 million, around 583 million tablets donated for 2021. And we see that this number may be maintained for 2022, as we have received a number of requests that are currently being processed. So you can have here on the second graph, different medicine donated per year. Yeah, from 2016 to 2021. You can see that the medicine that has the high number is albendazole, country requests for more albendazole, then followed by praziquantel, country request for more praziquantel. This is based on the disease as well. It's not just to request. The request based on the disease that is available in country, that is very prevalent in the country, etc. Yeah, so you have mebendazole and digicarbamazine, etc., that are less demanded, if I can say like that, etc. Then next, okay, now coming to the point, what are major access to medicine challenges in the African region? In this first graph, I've tried to be more holistic, not only for NTD medicine, but globally, because you have malaria drugs, you have HIV drugs, you have TB drugs, and so on, and laboratory consumables, etc. So the access challenges are almost the same. So you have in the first place, you have the issue with the selection and quantification and forecasting. This is one of the biggest access challenge, because people or recipient countries, they have challenges in quantifying the endemic population and being able to really capture all the population. Sometimes they over quantify, sometimes they under quantify, and this limits the sufficient availability of drugs, etc. So in different programs, just like I said, not only on entities. So you have unrealistic supply planning. For example, they may not receive the requested drug on time because they didn't plan well, or for any other reason, they may find themselves not receiving the drugs as per the plan. They don't take into account logistic lead time, procurement lead times, etc., and challenges, including the COVID-19 pandemic, all of that. Okay, another issue is on the procurement and supply chain management cycle as well. You have a fragmented supply chain with parallel systems. WHO is donating the drugs, and pharmaceutical donors donating through WHO, but you also have countries procuring themselves the drugs, and you also have some partners, for example, for their goodwill, they will kind of give drugs. You have NGOs, for example, they are procuring for donating to some countries, and this is not very coordinated. So you have these issues: poor procurement and replenishment, reorder planning, frequent stock out or oversupply, limited storage capacity, storage costs. And if I look at the NTD, neglected tropical disease supply chain, you know that these programs, they do not have sufficient funds to pay even the central medical store for the storage and transportation distribution. For example, the Global Fund drugs, sometimes they have agreement in place where the central medical store do everything, including last mile distribution, etc., and reporting on a performance-based approach, etc. But this is not the case for neglected tropical disease. So this is a challenge. Okay, yeah, we have ineffective logistic management information system. Some countries, they still use a paper-based to record the stock information, etc., and manage, going down to the low level of the system is very challenging, because where there are existing LMIS, those logistic management information system, sometimes they are limited to national level or regional level. It does not go down to the field at the service delivery points, etc., and that makes it complex. So you have prices. Prices are also other challenge in terms of access. You have, for the medicine that are not donated, for example, you see that the total cost to get the medicine to the client, to the patient in the community, or maybe buying it from a private pharmacy, it's become very expensive for the end user or the patient. So, you know, the wholesaler selling prices, and then you have tax and tariffs and high mix-up. So those are also challenges. Then monitoring, complex demand, lack of surveillance and transparency on access. Yes, sometimes you don't know who is providing what and when and where. So it makes it very difficult. And sometimes you may have falsified products. You don't know where is the source, etc. Mixed with the quality assured medicine, you may find them mixed, and then you don't know which one now is the best or not, etc. So it's quite challenging as well regarding that aspect. It's true that WHO has been supporting member states to improve access and limit fake counterfeit drugs, etc. in circulations, but this is a critical challenge for number of countries in the African region. Then you have regulation, quality issues, substandard, just like I said, time for registration. It can take a long time. You can submit the request for registration today and maybe probably not only getting it in 2024 or 2025 or 2023. It depends on each country regulations. So it's quite a challenge for many countries. Now, because they don't have qualified or quality infrastructure, for example, reference laboratory to conduct quality check or quality control, etc., it becomes very, even in terms of diagnostics and in terms of health technologies, it's very, very challenging. So you have also the problem with workforce, inadequate number of available staff, and they are not sometimes very skilled. You know, people going down to the low level of the system, going from the national to regional and the district. People, they don't have quality training, etc. They have not been well trained in supply chain. They don't understand the principles and the considerations, the supply chain considerations for products availability, etc. And you also have a inappropriate and ineffective use, dispensing without prescription. Sometimes this may happen. People administering drugs without looking at the guidelines, at the prescriptions, and maybe you may have adverse effects, and maybe this will create a lot of polemic, a lot of hesitation, and this can also be a kind of malversation or maybe poor marketing, etc., over the manufacturers or maybe the donation, the WHO or whoever is a stakeholder in that specific medicine, etc. So poor image, reputation, etc. That can also lead to that, and resistance or hesitancy to the drugs, etc. Then you have issue with governance, lack of governance in the supply chain, leading to unreliable and weak supply chain systems. So that's a major access challenges in globally, let's say, regarding access to medicine. Now, if we go to neglected tropical disease supply chain, next, okay, you have this cycle, which is the NTD, neglected tropical disease supply chain management cycle. It starts from the medicine preparation, medicine request preparation, submission, review, and approval. This is a challenging process where you have issues with late submission, poor quality of the request, which can be incomplete, inaccurate in terms of endemic populations, targeted populations, etc. And in terms of inventory reporting, etc., because there are several criteria that we use to approve a request. You know, poor quantification and forecasting. Then the next step in this process is the ordering, the procurement. Yes, for the drugs that are managed through WHO, you have sometimes unrealistic supply plans. For example, they are requesting for drugs in very short time. They want for the next 2 months, but they have not submitted the request on time, and the supply plan is not realistic. The delivery can take up to 8 months, including other aspects like tax exemptions, etc., preparation, packaging, booking, all the next steps. So you have all of that. Lack of transparency on government procurement. not every time government share the information on what quantities they are procuring themselves through maybe World Bank or whatever funding partners. And then no pool procurement, for instance, this is a donation managed by WHO currently, but in the long term, this is not yet a pool procurement. You know, even some countries or maybe some other agency, UN agency procuring themselves, for example, UNICEF, supporting some countries for some drugs that are oriented for children, maybe in UNICEF education campaigns or maybe etc. Yeah. So the next issues is around the pharma production and warehouse. We have this issue with the number of pharmaceutical companies that are sometimes have a burden of orders to manage, to fulfill. And this sometimes they have limited HR capacities and they have priority shift, etc. The limited space in the warehouse, they cannot produce more, etc. They want to ship what is already available before producing new or etc. new stock, all of that. So also to avoid overstock and expiry in the warehouse, we understand that from the farmer donors perspective. And we also have a green light, which is a critical area, late or no green light. Long delays to get tax exemptions and import permit, because before any shipment is made, we want to make sure that appropriate measures have been taken for free flow of the commodities, free flow of the NTD medicine when they reach the entry port, either the airport or the seaport, etc. Then you have shipping issues, availability of transportation. So basically, we have those issues that are oriented on the last mile, which are mainly on the custom clearance, delay custom clearance, tax exemptions, import permit, etc. Then country warehouses and storage with insufficient warehouse capacities, lack of funds to pay central medical store, just like I said before, poor storage conditions, all infrastructure. You go to a warehouse, you see that the window is open, there is no control of temperature, all of that. Those are issues that can, okay. Yes, if we go, we have late submission of the treatment data in terms of inventory, etc. We have insufficient transportation means, lack of funding, etc. for reverse logistics, etc. So globally, those are the issues regarding neglected tropical medicine. If we go to the next slide before I wrap up the presentation rapidly. Okay, what is ESPEN doing? So ESPEN has been working on two different strategic areas in terms of supply chain that include medicine application, improvement of the quantification and forecasting of medicine needed through development of SOPs, workflow, webinars, provision of technical assistance to African countries in terms of improving the job forms that they need to fill, technical assistance and accurate inventory management and balance reporting. And we have also been working with countries to conduct country supply chain missions where we identify the gaps and discuss with high-level authorities for improvement, and we agree on the improvement areas, etc., and training of national teams, etc., implementation of SOPs, development of stock management tools and district consumption tools, provision of funding to cover funding gaps where there is no partners to fund the distribution, because another issue is on expiry and wastage. When there is no fund to distribute the drugs, the donated drugs, there is a high risk of wastage. And if you take into account transportation costs and logistic costs, this is a big gap in terms of the transparency in the management and the effective use of the resources. Okay, next. Okay, so what we are looking at ESPEN perspective for the future years for PC, neglected tropical disease medicine supply chain sustainability. We would like to work with countries to strengthen, work with countries and partners to strengthen regulation of access to quality assured neglected tropical disease medicine to ensure equity, availability, accessibility, acceptability, and affordability. We will work toward mitigating the gap in availability of information and supply chain monitoring system for better decision-making, better data-driven supply chain decision, and scaling up innovative supply chain solutions with partners and demand aggregation mechanisms such as pool procurement, and we are available to accompany this type of opportunity or increase WHO work to make it very transparent and standardized and harmonized and well structured, etc. And also advocate for increased internal resources and domestic resources for uninterrupted supply of neglected tropical disease medicine, improve partnership, collaboration, communication, and coordination of stakeholders, and lastly, work toward neglected tropical disease medicine integration into national strategic plans and national supply chain systems for improved access to quality assured medicine, working with different partners and organizations. As you know, ESPEN being a partnership for global health to limit or to eradicate high burden of neglected tropical disease in the African region. Thank you.
Thank you very much, Modeste. So let's start the Q&A session with Isaac.
Thank you very much, Modeste, for the presentation. We have some questions already coming in from the audience, and it's quite interesting because most of the questions are actually similar to the questions that I'd prepared in advance to ask you as the moderator of the Q&A session. And most of them are actually related to the challenges you mentioned. So I'll ask, and you have already given some solutions of what needs to be done, what ESPEN is doing, but I'll focus on more specific questions that are really looking at some of very specific challenges. But before we go into the challenges, the first question that we got and that I also had, I apologize to the members of the audience who have written. I might not be able to repeat the questions word for word, but I hope I capture what you want. So the question is, do we have similar initiatives like ESPEN in other regions of the world, like for Latin America or Southeast Asia, Asia Pacific region? Do you have similar initiatives?
Okay, thank you, Isaac, for the question. I think for Latin America, the countries, they use the PAO, which is the Pan American Health Organization strategic fund, or they use the PAO mechanism as a pool procurement to procure medicine for neglected tropical disease, not only for the 5PC, but including some other diseases like Chagas, etc. And yeah. Then for other regions, I'm not very sure, but they also use the WHO mechanism. It's not called ESPEN, but they simply use WHO country offices to request for medicine, for donated medicine. Yeah, for example, in different WHO regions, for example, Euro, AFRO, AFRO, PAO, etc. So, yeah.
Okay.
Thanks.
No, thank you very much for that. Yeah. And I think it's interesting that at least for the African region, we have ESPEN, because one of the things that you mentioned as a challenge is the lack of coordination. And I think ESPEN is playing this role of really coordinating the data collection with the countries and then linking that to the demand forecasting and the suppliers so that you can have a better, more fluid supply system. And I guess this is what the member of the audience who asked this question was looking at. To move forward. So another question we got was, ESPEN seems to focus on donated medicines, but we know the issue of donation. What always comes up is on sustainability, and I know that you have been working on more sustainable procurement and supply systems. Could you tell us a little bit more about how far that work is going, and what are we looking at in terms of alternatives or supplements to the donation program to ensure sustainability?
Okay, thank you very much, Isaac. As you know, ESPEN, being a partnership, we work with different organizations and actors, and also part of the Neglected Tropical Disease Supply Chain Forum, which I think you're also part of it, where we have a group, a task force that is working on neglected tropical disease supply chain sustainability, which is also part of the WHO NTD sustainability. And you also in the WHO 2030 roadmap as one of the critical strategic area. So the group from the NTD Supply Chain Forum has been dedicating time to look at what are the considerations to ensure sustainability in different angles, including capacity building, including procurement, funding, and we were looking at different scenarios. For example, how do we strengthen the national workforce so that they are able to appropriately manage the neglected tropical disease and supply chain. We're also looking at areas, for example, information, supply chain data visibility and availability, traceability for decision making. So those are different areas where we are looking. For instance, we have the good news that the pharmaceutical companies, they are still there to support. And we hope that this work is a continuous work in terms of sustainability. We will be able to develop a global, through WHO, to develop a global guidance in terms of access to logistics, access to medicine and logistics, and what are the critical considerations. For example, one of the expectation is that we should be looking at countries, how many diseases have been eliminated through mass drug administration as a result of efficient supply chain management. And the other aspect would be how many countries have procured or are able to procure or allocate budget for medicine that are used to treat neglected tropical disease. In that aspect, when we have achieved that, we'll be sure that, okay, we have succeeded in sustainability, because, you know, sustainability, most countries are depending on the donation, but for any reason, if we just take the example of this year, where we have the FCDO that reduced or cut the funding for distribution, and we saw a lot of challenge from countries that were benefiting from that funding to distribute. So, you know, ESPEN continues to work with partners to look for appropriate solutions and sustainable solutions that will help expand access to neglected tropical medicine, neglected tropical disease medicine, and definitely eliminate or suppress the disease in the African region. Thank you.
Thank you. Just a quick follow-up question on that from the audience as well. Does this include this work on sustainability? Does it include manufacturing on the African continent? We know this is a big topic now in the, you know, in light of the COVID vaccine manufacturing. So where does NTD medicines come in as far as manufacturing on the African continent is concerned?
Yes, thank you. I think that point is a good point, but for now, I think we have not yet reached to that level of discussions. You know, this is a global matter that needs a global understanding of the matter, and including different actors, including pharmaceutical companies, doing situation analysis and looking at what are current systems and even leveraging on existing systems that are productive and that are efficient before looking at how to bring it on board in terms of putting it on the table and discussing it at the top level, at the global level. And I think that specific area is something that WHO headquarters can really take a lead on that, and starting discussion with major actors, pharmaceutical companies and other stakeholders in the global health, you know, maybe JAGntd, etc., and all major work on that specific areas.
Yeah, no, thank you. And I think it's also important to note that while, you know, manufacturing on the African continent could make sense where we're talking of large volumes, for example, for COVID vaccines, it might not necessarily be applicable for NTD medicines, because for some of the diseases, the volumes we're talking about, it might actually not be sustainable to do all the investments that come, you know, with setting up manufacturing, you know.
Yeah, exactly.
Yeah.
Exactly. That's why I was saying that this is a global discussion where major actors should be together. They look at the possibilities and what are the considerations and what would be the next step, and etc. Go or no go decisions, etc. Who is available, and yeah. Thanks.
Okay. Yeah. And one question from me. It seems ESPEN is focusing on the 5 diseases that are amenable to preventive chemotherapy that you've mentioned. Is there, or are there plans to go to other NTDs? Because we have, we have 20 of them. So what are the plans?
Yes. The fact that the ESPEN is focusing on 5 PC NTD does not says that other neglected tropical diseases are neglected. Even inside WHO, there are dedicated staff, medical officers that are responsible for other disease. For example, case management disease. You also have, so they are dedicated medical officers that are managing this. For example, you will see one staff that is for Buruli ulcer, Chagas, and other diseases. Yeah, so those are managed. It's just that ESPEN wanted to focus on I think those are the high burden neglected tropical disease, those 5, but it doesn't mean that the other neglected tropical disease. In fact, we work in a very coordinated way, even in AFRO, in the regional office for Africa. We work in a very coordinated way. We are under the same department, which is the communicable and non-communicable disease department, and we collaborate even when we conduct our country operations. And yeah, you must, if you even go at the level of the country, we are talking today about integration. So if you go to the level of the countries, this is at the very level of the countries. You have WHO country offices, and you have technical officers or national professional officers that are responsible for more than one disease. They are responsible for HIV, TB, emergency for some situations, in some countries, neglected tropical disease, malaria, all of that. So we try to integrate as much as possible to make sure that we really do things not in silo, and we do not forget other disease. Thanks.
Thanks. And
WHO is currently having a new, in the African region, there is a new structure that has been developed where we are calling MCAT, which is multiple country assistance team or something like that, where someone can be assigned from country office, can be assigned, or from the sub-region can be assigned 3 countries to coordinate the different interventions, WHO operations interventions in those 5 countries, making sure 3 or 4 or 5 countries, making sure that operations are aligned with the global strategy, global health strategy, etc., as per the WHO global program of work. Thanks.
Thank you. And just to zoom in on the question of funding and finance, this is at the heart of everything when it comes to access and delivery, be it manufacturing, procurement, distribution, health system strengthening, workforce training that you were mentioning. And, one of the paradigm shifts of the new roadmap, I'm not so sure it's still new anymore, but of the roadmap 2030 is to encourage more domestic financing, country ownership. What is WHO ESPEN doing to try to really mobilize this? Because if we don't have this component in place, then it will be very difficult to sustain. We talk of 2030, but I guess we're looking at even beyond 2030. So what is the work being done in relation to that?
Yes, thank you for that question. I think at the level of ESPEN, we continue to leverage external, wherever possible, external resources to support most countries in the African region. And if I just take the example we did recently, ESPEN developed a tool, a funding gap tool, to assess the situation for not only for the 22 countries that were supported by FCDO, but all the countries in the region where there is a funding gap. And the role of ESPEN is actually to only provide funding only in areas where neither the government has the funding nor a partner is available to support this. And this ESPEN continue to work toward advocating with countries to secure funding for mass drug administration campaigns. And we even continue to advocate for countries to secure funding for the treatment of population that are not targeted by WHO. You know, some countries, they request medicine for other population other than school-age children. You know, some countries request medicine for adults, some request for pregnant women, etc., and preschool age children. And sometimes when it comes to WHO to approve the request, we only approve what is donated for school age children, unless the pharmaceutical company is willing to donate. And in that case, ESPEN always advise countries to look for or to secure funding in case their target is higher than the target of the guidance of the WHO, for example. And in that case, we always advise them to look for other sources. And this is the reason where we have seen some countries using some other channels, for example, using the World Bank loan for their own procurement, etc., on using some procurement agencies, for example, to procure additional tablets, etc. And this is, I think, some even doing public-private partnerships to get the drugs directly from pharmaceutical companies. I think this is also something that can serve as part of sustainability, but it needs to be clear so that everyone is aware in case the donation says they should be able, countries should be able to budget, and we always advise them to be able to budget funds for their own ability to procure in case the donation says. Whoever, who knows, tomorrow can be very changing. Yes, and some pharmaceutical companies or whoever, for any other reason, or the COVID pandemic, etc., may say, oh, we have invested a lot and we think that we are going to stop here, etc. Now it will be to the countries to take the opportunity to continue to secure supply chain continuity, etc., neglect tropical disease, medicine availability. Thanks.
Thank you. Yeah, indeed, you mentioned an important point that it's important for us to have this transition from donation to country ownership, but there has to be a time period where there's a smooth transition. Yeah. Otherwise, we actually run the risk of causing.
Yes, of course. We had, for example, one country like Nigeria, in the country planning meeting, they requested, for example, what are the plans regarding the future? For example, how do we see the donation in the next 5 years, etc.? Is it going to continue, or what is the plan? How do they plan? How do they adjust to be able to face if there is kind of non-continuity, etc.? And we promise them that we will discuss that very important question at the global level during the next supply chain forum meeting, and where we will have to involve, just like we said before, you also said pharmaceutical industry and all the donor in terms of what could be done in terms of helping countries to plan transition and not waiting for the last minute to inform them that, okay, in next 2 years we are over, etc. We don't have ability to continue to supply, etc. I mean, from the pharmaceutical industry side. Thanks.
Thanks. Yes, I've been talking a lot. Yoshoka-san has raised his hand. He has a question. Yoshoka-san, go ahead.
Yeah, thank you. So we remember that Modeste mentioned many access challenges in your presentation with a nice picture in the cycle and each step with significant delays. You remember that? And I think these access challenges can be seen also as health system challenges. So my question is that can we think, or can we say that investing in ESPEN helps or contributes to health system strengthening in general in African countries?
Yes, yes, of course. As you remember, I show you the 5 priorities, strategic priority of ESPEN. You know that one of the priority was, if you go back to the presentation, you see that one of the priority was on strengthening health system for better decision making, etc. And the last one was on sustainability, if you remember. So those are core strategic priorities of ESPEN, and this really contributes to eliminating the neglected tropical disease in the African region. You know, we provide a lot of technical assistance in terms of disease impact assessment, and we are able, for example, to know which country is not eligible or has been treated, and that the disease has been decreased or eliminated. So through our efforts, through the investment that ESPEN, the resources that ESPEN try to get from different donors and partners, etc., those resources are very well used to increase performance in neglected tropical disease programs in the African region. We use opportunity for some time directly support countries in terms of planning of MDA, in terms of mass drug administration campaigns, in terms of training. We are improving the data management system through the ESPEN portal. So, you know, those are such investments that are really important in improving the performance of the program. If you don't have proper data management system in place, you are unable to tell whether you have progress or you are stagnating at the same place, etc. So it's very important. ESPEN is critical. ESPEN is very important in the African region and we have dedicated staff, as you know, per disease, medical officer, onco-LF, medical officer, schisto STH, medical officer, trachoma, etc. And for other neglected tropical disease, we have Chagas, case management. This is something that we really encourage, even if it's not under the ESPEN program. Yeah. So the ESPEN support is very, very welcome. You know, we organized yesterday and today the 4th ESPEN program managers and data managers meeting. That is today at 1 p.m. Brazzaville time. It started yesterday, and you can see there that many partners and in-countries partners are involved, including the neglected tropical disease community of practice, which is called Kikunzi, etc. So, you know, many program managers are attending that meeting, and if you are there, you will see how they are committed and involved, and they really appreciate the impact of ESPEN in terms of programmatic achievements and the long-term planning of the neglected tropical disease elimination. Thanks. So ESPEN really need the resources to channel resources toward eliminating those. When I talk about resources, these include financial resources, medicine, and technical assistance, I mean the brand for those that can be there to support countries as well in implementing WHO guidelines to eliminate the neglected tropical disease and making sure that the most needed, the most in need population, those are our client, our patient, they have access to quality treatment, and that they are recovered to achieve universal health coverage, etc. They are able to have good health, and they can be working for their different activities without being affected by the neglected tropical disease. Yeah, that's it. Thanks.
Thank you very much. And unfortunately, we've come to the end of our session. But I just wanted to end with a note that, yes, while this session was focusing on what ESPEN is doing and what WHO is doing, I think it's important to note that this is a multi-stakeholder, and the key to success is multi-stakeholder engagement and involvement. And this is one of the reasons why we're having this kind of sessions. But I also wanted to end with a note of what others could do by mentioning what we are doing from the Global Health Innovative Technology Fund, besides co-hosting and funding this kind of webinar series. We are also working with UNDP, ADP, and the government of Japan through a platform called the Uniting Efforts for Innovation, Access, and Delivery. And one of the roles of this platform is to really look at the challenges that you mentioned and try to propose solutions. And so far, since this platform started, we have actually come up with an analysis of the funding options that countries could use towards more sustainable funding, so that we could gradually shift from the donation program. And we've also come up with guidance to investment cases, because countries need strong investment cases to argue to get more money for whether domestically or internationally for NTD programs. And currently we're working with the WHO NTD department on supporting countries to really build these investment cases. And we're also looking at sustainable procurement and supply. So this is just examples of what others could do to support the work of the WHO, for ESPEN, and of countries towards more sustainable work in eliminating neglected tropical diseases. On that note, I'll hand over to my co-host, Yoshioka-san.
Okay, thank you, Isaac. So it's like we started talking about NTDs, but we are now ending up talking about health system challenges. That's very interesting. Thank you. So Modeste, thank you for joining us today, and it's very early morning in your time. Thank you so much.
Yes, I see that there are a lot of questions in the chat. We may not have time to respond, but always available in case we plan a new session only to respond to all those questions. Thank you very much for this opportunity.
So, yeah, maybe for that, just to mention to the members of the audience, we're going to send all these questions to Modeste, and he will respond, and this will be on the website when we, because the recording of this webinar will also be on the website, and the question and answers will be there as well for some of the questions that were not addressed during the session. So we'll be coming to you with the questions, Modeste. Thank you.
Great.
One more thanks to Modeste. Okay. Thank you. So let me talk about next session in January 2022. So we will invite Access to Medicine Foundation to learn how this foundation tries to influence the pharmaceutical industry for better access. And we will upload more details as soon as possible on JAGntd's website. And I hope you all can enjoy your holidays and vacations and come back to us next year. So thank you very much. Bye.
Bye.
Thank you.